everyone, welcome to the FutureDDS Specialty Series. My name is Nick Saber. I'm the current FutureDDS intern, and I'm sure many of you have the same questions as I do when it comes to getting into a specialty program. Today we're here with Dr. Jasmine Faldu, who is completing her orthodontic residency at UCSF. Dr. Faldu, thank you for being here today.
Yeah, of course. Thank you so much for having me.
So if you could just give us like a brief summary of your journey up till now, where you went to undergrad, where you went to dental school, and then when and how you knew that this specialty was right for you.
So I'm from the East Coast right now, like as Nick had mentioned. I'm an orthodontic resident in California, so in San Francisco, but originally born and raised in New Jersey. And I went to NJIT for undergrad, and I studied biomedical engineering because I wanted to do something with math and science on a biomaterials track, because that hit a lot of that pre-dental requirements that you needed to get into dental school. So that was what I majored in. And then I always knew I wanted to go to dental school. And to kind of hit on your very last question, I've wanted to be an orthodontist since I was in 10th grade. So it was always part of my plan. A lot of people asked, why did I pivot from engineering to dentistry? But it was never a change of heart. It was always my plan from the very beginning. And then I went to NJIT. After that, I went to UPenn in Philadelphia. So I did 4 years there, and then no gap years, directly applied to orthodontic residency across the country. I wanted to give myself a lot of options, and I matched at UCSF, and I'm really excited to be here in San Francisco. So from the East Coast to the West Coast.
That's awesome. So you said you wanted to be an orthodontist like from the beginning before you entered dental school. Okay, so when you were giving the interview, how did you talk about your interest in the specialty? Because I know a lot of interviewers, they want to make sure you're into dentistry first, and then then your specialty. So what did you do there?
Yeah, definitely. That's a really good point, because I noticed a lot of my personal statement when I was applying to orthodontics actually had to do more so with my undergrad degree, so biomedical engineering, because thinking like an engineer is actually very similar to how you think as an orthodontist, since it's a lot of critical thinking and treatment planning in the very beginning. You want to see where are teeth going to move, what are your mechanics going to be, and a lot of biomechanics, biomaterials, these things all tie together. So a lot of my personal statement actually tied back to my undergrad degree versus what I really learned in dental school. Because as many of you know, when you're in dental school, orthodontics is actually not that heavily taught, and you don't really get to practice orthodontics compared to, you get to practice a lot of general dentistry procedures. You get to practice endodontics. You get to do perio procedures. Ortho is very different. We're very long-term. You're seeing patients for 2 to 3 years. You're not really practicing that in dental school. So I felt comfortable reflecting back on my undergrad degree during my personal statement, but you bring up a great point. I was also very open with them that when I did get to dental school, I looked at all the other specialties. I thought about perio for a little while. I looked into dental anesthesiology for a little bit. I thought about oral surgery for a little while. And then I kept circling back, pros and cons list, back to orthodontics. So for me, I also brought that up in my interview, saying I really did try to branch out. I stayed open-minded in dental school, even though I knew I wanted to ortho coming in. And I think that's really important for anyone who may have a family member who's an orthodontist, or maybe have a parent or an uncle who's a periodontist, and you're going to dental school, and you're like, this is what I'm gonna do. I've seen it my whole life. This is exactly what I want to do. But when you get there, you want to make sure that dream, that's what I did for myself. Like, I wanted to make sure my 17-year-old dream was still what I wanted when I was in dental school. So I wasn't just like chasing this high school dream that I wasn't really sure if I wanted it anymore. So it's important to stay open-minded, and I think look at all the specialties, and if you're like really set on specializing, then making sure you know what you're signing up for, because unlike, I have a lot of friends in general dentistry and they love it because they get to do different things every day. So when you specialize, you get really good at a couple procedures and you do those every single day. And that's not a perfect lifestyle fit for everyone. Personally, I like that aspect of specializing in dentistry, but like I said, it's important to stay open-minded.
So what type of person would you say is a good fit for orthodontistry specifically? Like what traits or skills do you need to be able to succeed in this field?
So I think an important thing that puts ortho kind of in a different category compared to a lot of the other specialties or general dentistry is it is a lot of critical thinking and treatment planning. So every specialty you diagnose and you treatment plan, and then you do your procedures. With orthodontics, you are doing a treatment plan for the next couple of years. And I think that's what sets apart a lot of what we do, because every single procedure is not as hands-on as maybe doing a class 2 filling and like a restoration, or like I'm not drilling into teeth anymore, right? So I'm looking at the bigger picture. And I think that's an important aspect to remember when you're thinking about your personality. If your day-to-day, I'm using my hands, but I'm using them very differently than I did in dental school. So I'm not setting denture teeth. I'm not, doing endo with endodontic files. So I'm thinking more bigger picture. What's the overall smile looking like? So even when we practice, none of the residents, unless you're taking composite off a tooth after a debond, we don't wear loops, which was so different than dental school, for example. So you're really thinking big picture in orthodontics compared to a lot of the other specialties. And I think that does reflect back on your personality. Like, do you like that in general dentistry or in some of the other specialties, you're focusing on one tooth, you're focusing on one problem, and you're addressing it, and your patient's going home really happy? In orthodontics, we're seeing them for a really long period of time. So I don't know if that completely answers your question, but I think it's important to remember, what is your personality like, and what are you trying to serve how are you trying to serve your community and your patients?
Yeah, of course. That makes a lot of sense. So, in order to get into this specialty, are there any exams that you have to take before, like the way that DAT is for dental school?
Yeah, so in orthodontics, I don't know if it's like this for other specialties, but since a lot of the orthodontic programs are master's programs, they do require the GRE. So you do have to take that. And I know it's an entrance exam to get into other, master's programs. You think, I'm already a doctorate, I already have my doctorate degree, I'm applying to a specialty, why do I need to take the GRE? But I think they use it as another gauge, since you are getting your master's, and a lot of programs require research. So you're getting a certification in orthodontics, but you're also getting a master's in, like, for example, at UCSF, we get a master's in orocraniofacial sciences. So you do have to take the GRE. I studied for, I would say, 3 to 4 weeks for it. I mean, at that point, it's a harder version of the SAT. So reviewing vocabulary, I personally have more strengths in math and science, so vocabulary was something that I focused on. I used something called Magoosh. It's spelled Magoosh, I think. And it's an online website. It had videos, like tutorials, practice questions, quizzes. So I subscribed for that. And that, honestly, I think was the best prep that I could have done. It was easy to use. I like learning through videos. If anyone used, I think, Chad's videos when you study for the DAT. Yeah. So if you're a video learner like I am, I highly recommend Magoosh. I don't have any like stock or whatever everyone always says when they advertise about a source, but I personally tell everyone to use that.
Awesome. So you only studied 3 to 4 weeks. Do you think that was plenty? That was enough time?
Yeah, I think that was more than enough. I would say don't stress over that. No one brings it up in any of your interviews, but it is part of the application process. So you do want to score relatively well, that it's not standing out in your application in a bad way. You want it to just be part of your application, nothing to think about, like they're not going to bring it up as long as you've scored relatively well.
Okay. Yeah, that makes sense. So could you walk us through, like, the typical day in the life of an ortho resident? What kind of procedures you do, what type of people you see? You mentioned that these are long-term projects usually when you see patients. I assume you see them over and over again as well.
Right. So in orthodontics, since we see our patients for 2 to 3 years, we ideally see our patients every 4 to 6 weeks. So you can imagine once a month I'm seeing the same patient over and over again throughout their treatment. So my day-to-day, depending on what residency program you end up being in, everyone's didactic versus clinical versus research breakdown might be slightly different. But at UCSF, we're in clinic 60% of the time, and in didactic courses 40% of the time. Okay. So most of the day on Mondays, I see patients all day. And then Tuesday through Friday, we see patients for half a day. And then the other half are in didactic courses. So that kind of breaks down my day into, we're seeing patients during certain parts of the day. And then when we are seeing patients, we're doing everything that we can in orthodontics. So we have the consultation appointments, we have the records appointments, we have the adjustment appointments. So when we're actually actively in braces already, or if we have Invisalign patients. So we're going through the procedures, and we're going through bonding and putting on bands and things like that. And then going through the wire sequences as well as wire bending. Very different than general dentistry. It's not like I can't say, oh yeah, I'm going to be doing like a prep and a restoration. Right. But we have our own set of appointments that we do in orthodontics.
Of course. And how would you say that compares to dental school? So like in terms of workload and amount of social life that you get to have in residency, like what are the differences there?
Definitely, if you talk to, I think any resident versus dental school, residency is way better.
Oh,
I
cool.
think there's something, well, maybe not our oral surgery colleagues, but definitely in orthodontics, I've found a lot more life work balance. And I think the beauty of that is you've gone through 4 years of dental school, you know how to study efficiently, you know what works best for you. I would definitely say it's different in orthodontics because we don't learn as all the procedures in dental school. A lot of dental school curriculums don't really teach orthodontics to the fullest extent, which is why it's difficult to practice orthodontics once you graduate without a residency.
Hmm.
That being said, so there is a lot of learning compared to some of the other specialties, but every specialty you're going to dive so much deeper than you did in dental school that there's going to be a lot of learning across the board. So I think there's still reading outside. You know, you still want to read articles, you want to keep up with the literature, you want to read the textbooks, the classical textbooks for your specialty. So there's definitely a lot of learning still going on, but it's a lot of hands-on, right? You're seeing patients at a higher volume. You are seeing more patients. You're seeing your own patients now, right? Because now I've graduated from dental school, I'm board certified, so people are referring to me as doctor. It's very different than being in dental school, where almost multiple steps away, you're getting a check from a faculty member. This
Hmm.
is more you bring your ideas to the table and your faculty and you are communicating together on what are the best next steps for the patient. So I think that's a really important aspect to realize too. You play a different role in residency than you did in dental school.
Yeah, and I was wondering, like, who are you like mainly spending your time with? Because I'm sure in dental school you were surrounded by other dental students. You guys would study together, but in residency, there's fewer residents, right?
Yeah,
So
definitely.
so who
So
are you spending most of your time with there by like learning and studying?
So every program is different. So for mine, my class is really close. So we do review things together and we study things together, but everyone's also very independent, right? So it's a different stage in your life where I don't spend all of my time with my co-residents versus in dental school, I lived with my best friends who are also my dental school classmates. So you're constantly surrounded by dentistry, right? Residency is different. And that's a really great point that you bring up is that there's fewer of us and we're not that saying that we're older, but like we've already gone through 4 years of dental school, you're in a different stage of your life. So a
Right.
lot of my co-residents are married, some have children. So people have families that they're going home to at the end of the day.
Wow.
So people find time to study on their own. People find time to study together, maybe with one or two other co-residents. It really depends on a lot of factors like where do you live? Do you live close to the clinic? Do you live far away from the clinic? Do you have children waiting for you when you're getting home? So that's also important when looking at residency programs. What is the dynamic of the group? So our group likes to socialize outside of the residency program. We're very close. We plan, well, now with everything that's happening with COVID-19, we're trying to plan socially distanced gatherings for our new residents. That's definitely challenging. But overall, back like last year, we would always try to get together for happy hour. We'd celebrate birthdays together. So I think it really depends on the residents, and you're not completely always surrounded by them because everyone has a kind of an independent life as well, which is very different than dental school because you're almost living, breathing, studying constantly in dental school versus in residency. Like you asked me before, you definitely have a work-life balance.
And that's good to have, right?
Yeah,
Uh,
exactly.
so I'm wondering how difficult was it for you to find a residency program, or like how competitive was it? How many applicants like per school, and if you could tell us a little bit about that.
So orthodontics is notoriously known to be extremely competitive,
Yeah.
and usually when at least when I was in dental school, the mentors that we had said if you want to match into orthodontics, you need like a 3.97 GPA or higher. So you needed basically a perfect GPA.
Oh wow.
So that is definitely one aspect of orthodontics that I think from the get-go, when you are a D1, you need to make sure your grades are up. You definitely don't want to be fighting your third year, you're trying to apply to ortho and you don't have a great GPA because my co-residents are incredibly brilliant. We have orthodontics definitely is competitive in that sense academically. So at least to get your foot in the door, to get that interview, you definitely want to make sure you have good grades and that you've scored well on the GRE, like I said before.
Right.
So it is very competitive. My dental school class had 13 applicants, which was actually on the low end. So the class before me, so class of 2018, actually had closer to 30 applicants. But our year, we had more students apply to pediatrics. So I think it fluctuates year to year, but definitely it's a very competitive specialty. But I think it's worth every hardship that you do during the application process in all 4 years of dental school. I'm really, really excited to be part of orthodontics and to join the profession when I graduate.
So, and you said you went to Penn Dental, right? So they're not pass fail over there. They have grades.
Right. Yeah, we do have a GPA at Penn, which I actually really valued because I felt like as a candidate, it did make me stand out in the sense that I went to a school that had a GPA. So that was another number that admissions committees could look at and would be able to basically gauge my ability to handle heavy coursework, right? Because dental school, across the board, no matter where you go to dental school, you are doing an insane amount of coursework in reading and exams. So I actually really liked that we had a GPA. I don't know if I would say the same when I was actually in dental school, and I was like, wow, I can't believe we have grades versus there's some programs that are pass fail. But I think now reflecting back, that it was a positive thing.
Yeah, it gave you like a competitive edge.
Right, because they knew that the curriculum was graded. So my grades were actually truly reflected. An A was an A and a B was a B instead of just a pass fail.
So what would you say for dental students who are in pass fail programs? Like, what should they do to make themselves stand out? Because if everyone passes at their school, then they need extracurriculars, right, to make themselves unique. So what would you recommend for them?
Yeah, definitely. I think regardless, even though I went to a non-pass fail school, you definitely need to do things to make yourself stand out. And advice that I've always given to pre-dental students is that you want to be committed to one or a few things. You don't need to be the president of every club. You don't need to be, your resume doesn't need to be 4 pages long, but at an interview, when you talk about something you're passionate about, you really want to show that you've dedicated time to something for the last 4 years. If you're really into community service, go for it. Like, do community service and get involved in the community and show that that was a strength on your application. If you're volunteering every Saturday and Sunday and on the weekdays, maybe you don't have time to do research, and that's okay. I think one of the scariest things about applying is, I need to make sure I fill like every single category. And I think that's true. You do want to have no part of your application that's blank, like straight blank, but you also don't need to be a superstar in every single category. You want to show that you are passionate about something, that you have followed through with goals and a vision for the last 4 years. And I think that holds a lot more weight, especially in an interview when you're talking to an admissions committee and they can say like, what makes you you? You can share with them what you're passionate about. And I think that to me will hold more weight than saying I was a part of 15 clubs and I did 45 million things, but maybe you don't have a true passion about any one thing. So even if that's outside of dentistry, maybe you're in a band and you play an instrument and that's something that you like to do in your free time. Great. Maybe you're an artist and you like to draw or you like to paint. Those are like my co-resident sculpts marble in her free time. That's awesome, right? So it doesn't have anything to do with orthodontics, but it has to do with something that makes you a well-rounded person. And I think that's what you need to focus on throughout your 4 years of dental school to make yourself stand out at the end of the day.
So what is it that you did during dental school? Like, what were your extracurriculars? I'm sure because UCSF is all about giving back to the community. Was it something relative to that?
Yeah, so I did, my focus on my application was a lot of my community service. So during my 4 years at Penn Dental, you have an option to do an honors in a couple of different categories. So I did honors in community service. So that meant that I did X number of extra hours of community service. So my project was over a year and a half, and we started to incorporate infants, so age 0 to 5, into our dental curriculum. So teaching dental students, how do you go through a dental visit with a patient's mother about how to take care of their infant, how to take care of as their baby teeth are erupting, like what is important for a mom that's pregnant for oral hygiene. So we really focused on that. We went to the local libraries, we held sessions with expecting mothers, we made posters, we incorporated things into the curriculum. There was actually a new portion in the schedule set in the pediatric department for what we called First 5. So patients who had a child that was under the age of 5 for their dental appointment. We learned how to do knee-to-knee lap exams. So that to me was a huge part of what I talked about in my application. Starting this program, pioneering this effort at Penn Dental to make sure that all dental students would understand what it's like to treat a child that's under the age of 5, right? So it's like an infant, they may be crying, it's uncomfortable, right? But understanding how to do a lap exam properly. What do parents need to know? Anticipatory guidance, things like that, that maybe we didn't necessarily learn in the beginning of dental school, incorporating it into the clinical years for D3s and D4s.
Wow, that's really admirable. That's a
It was
great
really,
compliment.
it was a really cool project, and it was through my honors in community service. So that was something that I really focused on during my application because I felt like it was a huge part of what I did during dental school.
Mm-hmm. So do you have any other recommendations for pre-dental students to do? Like, because again, like I said, the dental schools usually want you to focus on dentistry first and then specialty, but what would you recommend like for pre-dents to do right now? Like what can they do to get started?
I think an important thing is to stay involved in the community as well as in your dental school. So if there are clubs, which every school mostly has clubs, so get involved in a few things that you're passionate about, and then as you progress throughout your years, then try to become, an executive member on the boards. So try different things out. When I first started dental school, I was in the pediatric society as well as the orthodontic society. So I knew both had to do with children. I really like kids. And I was like, I can learn a lot from both of these clubs. And then slowly throughout dental school, you can start to narrow it down, right? So you don't, like I said, don't be a part of 45 things. But one thing is for your freshman year, your D1 year, try everything out. Learn about everything. Learn about implants. Learn about endo. Learn about perio, oral surgery. And then really start to narrow it down as you start to realize what kind of patients do you want to treat? What kind of procedures do you want to do on the day-to-day? What do you want your lifestyle to look like? Do you want to be working in a hospital or do you want to be working in a private clinic? These are slowly things you can start to develop during your third and into your fourth year when you start seeing patients. And then really as a first year and a second year, I think just staying open-minded, trying as many things out as you can, because everything's not for everyone, right? So you might quickly find out that one specialty is not for you, but you would never know that unless you tried it or unless you learned about it.
Mm-hmm. Those are great tips. Well, that'll be it for this episode. Dr. Faldu, thank you again. Really appreciate your advice. If our audience has any questions, is there any way they can reach you, either by email or Instagram or?
Definitely. I don't have a dental Instagram, but you can email me it's my full name. So Jasmine and then .Faldu, Faldu @ucsf.edu.
Great. And we'll include that in the description as well for this video.
Okay, great.
Yeah. So definitely, we really appreciate your time. It was
great to be here.
Helpful.
I'm happy to answer any questions anyone has. So don't hesitate to email me, and I try to get back to people within 48 hours if I can. So.
Thank you, everyone. If you haven't already, make sure you hit that like and subscribe button. And if you do want to be notified when we post a new video, make sure to hit that notification bell. Other than that, we'll see you next time. Bye-bye.